So, hello everyone. Today we are here with Dr. Vijita and Dr. Shyamaka to discuss on a very interesting and very important topic, the revolution teleconsultation is bringing in neurorehabilitation. So, the world is going digital and so is healthcare. It's really a boon when you think about it. So, to begin with, I would like to ask you that what really is neuro teleconsultation? Can you shed some light on that?
Good morning, Sunidhi. Thank you for hosting such an informative session. So basically, neuro-rehabilitation is rehabilitation being delivered virtually. There are barriers of distance, time, expertise, which prevent patients from getting the correct rehab and after suffering from neurological conditions such as stroke, Parkinson's, etc. So, teleneuro rehab basically helps them to overcome these barriers and get the expert rehabilitation at wherever they are. They can avail this at the comfort of their homes. They can avail this facility if if in a community rehab as a community rehab program. So, telerehabilitation basically helps us to overcome the barriers of time, distance, and also is very cost effective.
Good morning. Good morning, Sunidhi. Thank you for hosting this
Hi, good
session.
morning.
So, just to add something to what Dr. Bigita already said. Now, tele-rehabilitation in Nigeria presently, even before we started having massive brain drain, there was a shortage of rehab professionals in ratio to the profession to the population at hand. Now, with brain drain, that means that this pool has shrunk further. We have less rehab professionals attending to over our massive population in Nigeria, which is still a growing population. Now, what tele-rehabilitation is delivery of world best care to these people. So,
Yeah, please continue, Dr. Chamaka.
okay, so what tele-rehabilitation is helping us cross this barrier of both the shortage of staff and helping us cross the barrier of distance and time. Now, apart from the shortage we experience in Nigeria, presently, rehabilitation service is not available in everywhere. Most of the general hospitals don't even have rehabilitation departments. Some federal teaching hospitals are massively short-staffed. So what this tele-rehab is going to do is that we're going to cross back distance and get to the people that don't have access to this rehabilitation. Now, apart from that also, in Nigeria, what we have mostly is physiotherapists. We have a low number of speech therapists. I think we have only 3 institutions that currently train speech therapy in Nigeria. So you can imagine the shortage we have. We have low occupational therapists, just to mention a few. So this is bringing rehab professionals that we need in Nigeria to our doorsteps.
Also in our program, we develop customized protocols for the patient. It is not general programs which we deliver to the patient. And our experts here demonstrate the exercises or the protocols live to the patient. So they are not provided with pre-recorded videos which are available on different apps. So we make the patient do whatever is best for them and suited for them. We demonstrate it live, and also if the patient can perform it with the help of Dr. Chiamaka's team there at Nigeria, or with the help of a family member and or an attendant if they are taking the program from the comfort of their homes.
That's really great. So, my understanding of virtual neuro-rehabilitation services is that it was introduced in Nigeria to solve bigger problems like accessibility to the right care, and along with that goal, promoting ease of treatment. However, many challenges bother Nigerian people. They often question, is teleconsultation really helpful? Can it really bring a positive outcome in my current condition? There is clearly a lack of trust in online practices and a seed of doubt regarding comprehensive training, skills, and qualification of professionals in telerehab services. So, how are we eliminating these challenges?
See, the professionals involved in the program are trained, and they have a complete degree into rehabilitation programs, and they have an experience of more than a decade. We do not encourage people who have not been practicing neuro rehab to be a part of our team. So the delivery is done by a team who are totally professional and have an experience of quite few years.
Okay, to add to that, all the professionals in our facility that is going to help deliver this care in Nigeria are appropriately trained. They have current practicing licenses, and we try as much as possible every year to do a refresher course on neuro-rehabilitation in our facility, or a refresher course in rehabilitation generally. So, an additional step that we've taken to make sure that you're receiving the best possible care is that we try to train all our staff on what it is to expect in telemedicine, what it is to expect in tele-rehab, so that they're able to deliver this care to you.
Right. So I was reading a lot of studies, and according to a recent study that was published by Cairo University in Nigeria, patients with stroke receive rehabilitation services in three ways. They can go to the hospital wards, or they can receive it as outpatients or at home. But due to lack of rehabilitation resources, patients are usually discharged early on from the hospital, while older patients struggle to make frequent hospital visits. So, how is tele-rehab turning out to be a boon in such cases? Can you shed some light on that?
Yeah, sure. So, Sunidhi, we suffered pandemic for 2 years, and it's not like that. It's not like that during that period people did not suffer any kind of neurological disorders. Uh, along with the pandemic, these diseases were also there, and also patients were there who were taking rehabilitation programs uh, pre-COVID, and they were devoid of the accessibility to physical centers during
Right.
that period. So we have an evidence in 2020 alone. We had delivered worldwide. There was a delivery of more than 90,000 hours of tele rehab programs. And we have a percentage of almost 94% people telling us that rehab delivered virtually was equally effective for the patients who were taking it during those periods. So we have continued the trend after that as well. Also, it is very cost effective. There are patients who do not want to leave their homes and visit physical centers post COVID, since the fear of infection is still there. So for them also, this has become a blessing in disguise.
Right. So what's your take on it, Dr. Shamaka?
Okay, like Dr. Vijita already said, then COVID made telemedicine all around, not just rehab to home. So sorry, 1 minute. So COVID made telemedicine, not just telerehabilitation, to home. So we've seen that it is possible to deliver to deliver medical care online. And also in Nigeria, we have undeniable. All across the country, we have security challenges. So this is making frequent hospital visits difficult for people. Now, also factoring in the fact that a large demographic of people that seek neuro-rehabilitation are aging people, and the issue of getting transportation to come to the hospital, on the frequency they need for this rehabilitation to be effective is a challenge. So what tele-rehabilitation is going to do is that we are coming into your home to come and deliver this care without putting you at the risk of being on the road for security issues, without incurring further expense of logistics and transportation. So I believe that this is something that is more effective doing this.
The patients are not devoid of the treatment. Even if they are not
Right.
able to access the physical centers, they are not devoid of the treatment, and they are on the right road to recovery. Because after neurological disorders, the the disability ratio becomes high, the people become dependent. So that can be controlled if the patients are not able to access
Hmm.
physical centers. We cover that gap with tele rehabilitation.
So, as Dr. Vijita mentioned earlier, there are many countries that are already, benefiting from tele-rehab services. They have produced impactable results, and many studies are there to prove that. But when we talk about countries like US, which are already developed, they also have developed infrastructure when it comes to technology. But however, Nigeria is still underdeveloped in certain areas, and technology might be a point of concern. So, how are you dealing with that issue, and how are we resolving it? So, yeah, can you comment on it?
So we recently carried out a poll among health professionals of Nigerian extraction practicing within Nigeria and in the diaspora. And from the diaspora results, one of the things, even most of them were hyped. Telemedicine is something that is being practiced in the UK and the rest of the world, and it's something that they would like to see happen in Nigeria. But one of the concerns they raised is that how are we going to get along the technological infrastructure? That is, while Nigeria has a booming tech industry, we still know that we are not quite there yet, especially in the area of network coverage in around the country. So that is why we with Medigence have decided to what we're delivering in Nigeria is a hybrid form of telerehabilitation. It's not the pure telerehabilitation that is practiced around the world. What a hybrid form means is that we are combining both in-person and virtual rehabilitation. And Titan is providing the in-person rehab. And we have the largest affiliate network of rehab professionals all around the country. So this means that there's almost in every state in Nigeria, we have a professional, we have an affiliate present. So that means that time and space is not a barrier for us. Yes, we are mostly located in Anambra and Abuja, but we have professionals in every state that will be there to help deliver this rehab to you. So what the hybrid means is that we are coming into your home, and we are also Medigence is joining us virtually to help deliver your program to you. So I think this goes around most of the challenges that most of them mentioned.
Also, Sunidhi, our technology is very lightweight. It can be accessed, it is device friendly. It can be accessed through any device like the tablet, laptop, mobile. So it is very easy to use. We do, though the world is like at 5G right now, it can easily run with 3G networks as well. And internet issues are there they're everywhere. So even if during the session, due to some or the other issue, the session gets cut abruptly, we can reschedule the session with the convenience of the doctor and the family. So that's not an issue. And as Dr. Chiamaka said, there would be few sessions which would be done at her center. And if there is a barrier of distance, for example, for the patient to come daily, so after completing few sessions, like 7 to 10 sessions at her clinic, they would be conducting, we would be, the process would be ongoing through our telerehab platform, which is very robust. And also the security, the data security of the patients would be maintained. The patient's details will not be divulged outside. We are DEMOS certified, we are HIPAA compliant, we have all the security measures at our disposal. So that would never be a problem for the patient. Privacy would never be a problem for the patient.
Right. So, as you already mentioned about HIPAA compliance, so my next question already was to ask you about the privacy, because privacy is a big concern, be it in developed countries or third world countries. Privacy has been a major concern for patients. It's their personal data, it's their healthcare data, and they want the promise of confidentiality. And when they are choosing a tele rehab service, they need that confidence while booking a treatment package. So how do we ensure that they get it?
See, this is not a new thing which Medigence has been doing. So we have our presence in about 90 plus countries. We have already assisted 1 lakh plus patients till now. And our technology it is following the HIPAA and the GDPR compliance as well. So we are DEMOS certified. So the data and the privacy of the patient, as I said, would be maintained at all levels. It will not be diverged. Even we do not have the complete, we cannot access the patient data at our end. only if the patient requests us, then only we can, try to recover the data.
So, Dr. Shamaka, do you want to comment on this?
Yes, I understand that privacy is a concern for a lot of patients, and this is like Dr. Vivita said, this is not something that is new for medicals. They have been present in over 90 countries, countries with stricter data laws than even Nigeria has, and they still don't have a, for want of a better word, a black mark on their book. So you're sure that your data is secure with them. Us at our end, like you mentioned, we can't access your data from our end except to give the permission for that. And in part of the paperwork that we are presenting this patient, it's confidentiality agreement between us and them. So you can be sure that we are going to keep whatever it is confidential at our end.
Also,
Right.
Sunidhi, the patient would be getting dedicated patient care support at every level, so they will not have any issue while accessing the platform, and we would be directing them and helping them at every step if required when they are about to log in or something.
Right. So, to end this very informative session, I would like to ask one last question. That Nigeria has a cluster of physiotherapy clinics and centers providing in-person care. But one thing that is missing in most of them is the international standard of care for Nigerian people. Because we are not just any other care center, I would like to put across a question and ask your expertise on this, Dr. Shoma, that what is the benefit of tele-rehab as a service and how Medigens and Titan have come together to deliver it.
Okay. So Nigeria, we have a cluster of physiotherapy clinics all around the country. But what we don't have is a full rehab team in most cases. That is the first point. So what Titan and Medigens have done is that we are coming together to provide that full rehab team. Now we have a very few centers that offer holistic neuro-rehabilitation in Nigeria presently. So what yeah, most people don't know that part of the rehab team, that the rehab team is not made up of only physiotherapists. We have physiotherapists, we have speech therapists, we have occupational therapists. And this is just what Titan, what Medigens is offering us is the chance to have a rehabilitation that is wholesome, not just international best, but wholesome. So you don't have to, people with speech difficulties, you don't have to just assess the therapy aspect of it, and we are leaving the speech therapy to chance. So we are offering you full rehab care. And in addition to that, accessibility still is a problem in Nigeria, and it's still a problem that we are trying to solve in Nigeria. So what we are doing is that now, even if your loved one is in a state or in a local government or in a town that doesn't have access to physiotherapy clinic, what we are bringing to you is the chance for them to stay in the comfort of their homes and have a world-class rehabilitation brought to them.
Right. So, Dr. Vijita, do you have to say anything on this? Add on to it.
Yeah, so it is the same thing. We have tied up with Dr. Chiamaka's highly skilled team to deliver the best outcome-based rehab programs for the patients, which are at par with the international standards and are supported with evidence. They are result oriented and they have proven results in patients who have been laid back with the treatment for a long time. Even like, we could deliver these programs to patients who had not got the accessibility to physical centers for a long time, and through this program we could get them back to the normal lifestyle even after like 2 years, 3 years, 4 years post stroke or any other neurological conditions. So as I said, both skill and technology, when they come together, it gives tremendous and it gives brilliant results.
Right. You're absolutely right. So, as you said, I also believe that accessibility is one thing, but and an important one at that. But effective outcome for patients is our main aim. So, I think that this will be the end of the session, and it was a very informative one indeed. And thank you, Dr. Shamaka, for taking out the time and joining us, and Dr. Vijita, thank you for your time. So, like, we would end this by, I would just like to say that for people to know that how beneficial tele-rehab can be for them, the only way is to book a session with us, see it to believe it. So, thank
Yes.
you.
Thank you, Sunidhi. Thank you for hosting this
Thank you
program.
so much. Thank you for hosting the session. Thank you so much.